This is the second of two videos on food poisoning and will discuss the treatment. Management of food poisoning includes resting at home, as most cases are mild and can be managed at home. The best liquid to take to correct hydration is oral rehydrating salt or ORS, which contains a mixture of glucose and sodium. An alternative is commercial sports drinks like Gatorade and 100 Plus or fruit juices, which are all acceptable if one is not dehydrated. If one is dehydrated, oral rehydrating salts or ORS is still the best. Eating small meals with little fat like rice, porridge, soup, noodles, potatoes, biscuit crackers, banana, and bread may provide additional nutrition. Avoid dairy products, spicy foods, oily foods, and coffee. Fortunately, most people recover from food poisoning without the need to see a doctor. The patient needs to visit a doctor in the following situations: if there is blood in the vomit or stools, if fever is more than 38.5 degrees Celsius after a day, if there is severe stomach pain, if there is severe dehydration. Being severely dehydrated means one has lost a lot of water. The symptoms of dehydration include thirst, dry mouth, dry skin, less frequent urination, where the urine is dark in color, headache and dizziness, rapid heart rate, and tiredness. If one has persistent vomiting and is not able to drink liquids, if someone is pregnant, if above the age of 60, if there's an underlying health problem like heart disease, diabetes, kidney disease, and finally, if one has a weak immune system because of medication, HIV, or cancer treatment. Once admitted, the following treatment will be given to the patient. If hospitalized, the doctor will give fluids through an intravenous line. This is a thin line that goes into the veins to prevent dehydration. Treatment to relieve symptoms is given, for example, drugs to relieve diarrhea, for example, Imodium, Lomotil, Smecta, medicines to stop vomiting, and for stomach pain. Antibiotics are given for certain bacterial infections, particularly if there's blood in the stools. Traveler's diarrhea is treated with antibiotics. However, most people with bacterial infections do not need antibiotics. Antibiotics are not helpful if the food poisoning is due to a virus. Sometimes antibiotics might worsen the food poisoning. Let's now look at how one can prevent food poisoning. Using the same cooking board and knives to prepare raw meat and fresh vegetables, and mixing poultry like eggs and fresh vegetables on the same cooking board and using the same knife may result in cross-contamination in bacteria from the raw meat crossing over to contaminate the fresh vegetables.